We're at the IAS meeting in Amsterdam. We're here with Carl Dieffenbach, who is director of NIAID.
The Division of AIDS at NIAID.
And we appreciate your doing the updates as you do each conference, and it's so important to understand some of the nuances and some of the details, especially. But if you could kind of give us a sense of what you thought was important at this conference.
So this meeting has had a couple of very important findings, mainly on the use of antiretrovirals for either treatment or prevention. So you've already talked to Pedro Kahn, who's talked about his combination 2-drug study at 48 weeks, which was equivalent to 3 drugs. So it was dolutegravir plus 3-TC versus a 3-drug combination based on dolutegravir. So that was an important study. As you walk around the conference, there are other drug combinations and other fixed-dose combinations that are moving forward through levels of approval that it used to be in the day when those were presented at a conference like this, they would be plenary sessions. They'd be in a plenary. This is so commonplace now, and that really is a testament to the field that they're now moved to posters and late breakers. So that's a really interesting change and an important one for the field. We continue to have new drugs coming forward and some new drugs with some very interesting pharmacology. There's at least one new non-nucleoside reverse transcriptase inhibitor that also has a long half-life that could be used in weekly pills. So I think that incrementally we're going to continue to see improvement from 1996, handfuls of pills, 2016, 1 pill once a day. Maybe in the next 3 or 4 years we'll be down to a pill a week and then a pill every month. And I think that we're just going to continue on this evolution as therapy is going to continue to get better, safer, and hopefully less expensive for people living with HIV.
And the fixed dose combinations also are better, but they're also saving money.
They are, and it's also easier to take 1 pill rather than a couple. Right. I think that's very important. On the prevention side, we've seen how the use of PrEP can change the world, and the French presented a study here that is looking at daily PrEP versus episodic PrEP. And in about halfway through their study, they still have no transmission in either arm, showing that the PrEP in the setting of the study is quite effective.
That was John Michel.
Exactly, John Michel.
He actually presented, so I mean.
Oh, okay. So, but we're part of a flavor here, and the other is the partner study that looked really important here in terms of the fact that it proves once and for all that U equals U, and when you are virologically suppressed, whether you're a heterosexual man or woman or a man who has sex with man, you are good to go with full virologic suppression. So in the broadest sense, that's where the field is at. Some of the most exciting work being done and presented at this meeting is dealing with the broad neutralizing monoclonal antibodies. Right. There was a session today where Michelle Nussenswag from Rockefeller presented new data from a small study that had relatively few people, but using his 2 antibody combinations, he had a couple of people that had gone out a very long time and seemed to have hit a new set point that was essentially at an undetectable level. And that's because antibodies work in 3 ways. They can kill infected cells, they soak up free virus, but they can also soak up the virus and the infected cell components as antigens and improve the immune response. And that seems to be what Michel is seeing in his studies. So this is a harbinger of things to come as we start using additional combinations of antibodies as therapies. So there's a lot of excitement in that area, and that will be, in 2 years, that's going to be one of the major highlights at IAS 2020 in San Francisco.
So do you think that we'll still use with the injectable or infusible or however the monthly or quarterly injection is, do you think we'll still have pills in with that? I mean,
I think what we're going to have is a range of options for people. I think there will be people that want to take a pill, and some people will be better at taking a pill daily, and others will want pills weekly. I think there will be some people that will want an injectable or an implantable, but all of it will require that if we're going to use antibodies, we may need to start with a combination of pills and then move to antibodies.
To make sure it's okay.
Make sure that people are virologically suppressed as we move into using the antibodies.
Because once you have it in the body, you can't take it.
Well, that's the issue, is we're still working on the cure.
Yeah.
And there were 2 good plenaries at this conference on cure, and both of them pointed out the significant challenges we face in trying to get a cure and where we eradicate HIV from the body. And Dr. Fauci said we have to do a risk-benefit analysis because the therapy needs to be as safe, if not safer, than treatment. It has to be cost-effective and it has to be scalable. So that's a tall order to go up against a fixed-dose combination.
Yeah. So I know I have Sharon Lewin's going to probably talk with us about the cure and that work, and it's always good to dig into her because she's always got little tidbits that are coming down the pike that are really important. We always have to temper everyone's enthusiasm with hope, along with the hope, with some, just be easy on it. Don't set your expectations too high or too soon. But we always hope for a cure down the line at some point in our lifetime, anyway.
Yeah, I agree, and I think that what we have been able to do, though, through antiretroviral therapy, is and the U=U movement is hopefully change the course of people's sense of self-worth. So, as an HIV-positive man, you are now freed from stigma. That you're not a disease vector. You are a human, and you are free to love. And I think that's the strength of what Bruce brings with U=U. And if we can then put a cure on top of that, it will be even that much better.
Yeah. Down the line, I think we're going to have a number of ways in which we can imagine a new world. But right now, I think, and as so Elton John put it so eloquently and sometimes pretty demonstrably, we have the challenge with the criminalization issues. And it really is the biggest stumbling block, I think, now. I think it seems like we take this focus and put it different places over the course of the conferences. But that is really an important one, because
it is.
If the people can't take the drugs, then we're never going to get to a zero new infections.
That's absolutely true. And so being able to, and in some ways the drugs are the ticket to decriminalization, to removing the laws, because if people can get access and stay on therapy, there is no chance of transmission. I think that's an important point, and continues to be an important point. And these countries that continue to support this kind of legislation are going to. We need a way of putting political pressure on them.
Right.
That's the challenge we face.
And I hope we all can be a part of that, for sure.
I think we can.
Yeah. Well, thank you very much. I appreciate your time to present this overview, if you will, of the conference. It was great.
Well, thank you, Fred. It's always a pleasure to see you, and
all right.
We'll see you soon.
Yep, thank you.